questions, but, you know, I guess if we feel like it.
Call the March 16th, 2020 Spokane City Council meeting into session. Please join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, can you call the roll?
Council President Biggs,
Present.
Councilmember Cathcart,
Present.
Councilmember Mumm,
Here.
Councilmember Wilkerson.
Here.
Let the record reflect that council members Burke, Kinnear, and Stratton are absent. We're also joined on the council by Mayor Woodward.
All right. Thanks, everybody, for coming tonight and tuning in wherever you are. I just wanted to give a little bit of update on process and procedures since we've made several changes. And then I'll give you a little preview of what's going to happen. We're going to hear some, I think, very timely reporting from various city staff and community members. But just to let you know, we were going to have a town hall meeting tonight where neighborhood councils were going to come report, but we canceled that. And we also met at our 3:30 briefing session, and we approved several board appointments that had been previously scheduled, and we went through our legislative agenda for tonight and got that over with so that we could focus on reporting, and that included a budget ordinance that allowed us to hire a director of emergency management, and also we referred the Centennial Trail Summit Gap project to the Design Review Board. We declared a couple of fire trucks as surplus and donated them. And we also deferred the notorious mosquito ordinance that was going to be next week, and we deferred that to April 13th, when we're hopeful that we'll be able to accommodate more people in the chamber, since a lot of people have opinions on that. We are operating under the no more than 50 in one location. And the other thing that we did at our meeting this afternoon was we passed a resolution in support of the mayor's declaration of civil emergency. So we'll get to all those things. But first, and you might have noticed, 3 of our council members aren't feeling too well. They participated fully by phone this afternoon, but since we're not picking up any business today, they are not calling in. I'm sure they're watching. And if you didn't see the announcement, we're not holding any open forums or any public testimony. We are planning on meeting next week at 6 p.m. for a regular council meeting. But with that, I'm going to invite up Dr. Bob Lutz, who's the health officer from our health district, and he is going to give us the latest update. And I did, while you're coming up, Dr. Lutz, I just wanted to thank you and commend you for all your hard work in the last few days. It's been a pleasure working with you. I've seen you working around the clock and talking to you at all hours of the day and days of the week. So thank you so much for your work.
Thank you. Thank you. Is this on? Not sure. Is this on? This is on. Okay. Well, thank you, Council President. Thank you, Council members. Thank you, Mayor Woodward. Yeah, a lot has changed since I was here last week. And I would suggest to you that probably next week when I'm here, maybe more things will change. This is a map last week. Actually, I didn't have a PowerPoint presentation. This is a map as of this morning of what it looks like across the state and the country. So as of this morning, 3,800 cases. As you know, Washington State still, unfortunately, has the notoriety of leading the country with most cases. New York is close behind. That is compared to this, which is the worldwide, almost 175,000 cases, 6,700 deaths. We are certainly seeing different responses in different countries. We are seeing, obviously, the issues in China have dissipated significantly. Italy, conversely, is of great concern right now. We're seeing an almost 4.5% mortality rate. I contrast that with South Korea. South Korea, at some level, represents a real success story in that their approach was mass screening, which allowed them to then really encourage isolation, self-isolation, social distancing. And then again, just that, all of the, what we call NPIs, which I'll talk about in a couple minutes, they've been very successful in that effort. So when we talk about the epidemiological curve, which I'll share with you in a bit about flattening the curve, they have truly found themselves on the flattened curve. And their mortality, in contrast to what we've seen in Italy, is less than 1%. Overall, internationally, we're seeing a mortality rate of between 2 to 3%. So I would suggest to you they're doing something right. This is statewide data that were presented to us as health officers yesterday by the state health officer. And this is ED visits, and this is over the last 2 weeks. And what I take note of here, this is CLI, now stands for COVID-like illness. This is not necessarily diagnosed, but nonetheless presenting with symptoms that are consistent with COVID-like. One of the issues we've talked about is testing. That's another conversation. But do take note of that uptick over the last 2 weeks. Pretty significant. Those are ED visits, though. What maybe is of greater concern is this. This represents hospitalizations. So this is our concern. This is our concern from a systems capacity standpoint. Because it's one thing for individuals to present to emergency rooms with this constellation of symptoms. It's another thing for the hospitals to actually require these patients to be admitted. And we're knowing, again, nationally and internationally, about 20% of individuals end up requiring hospitalization. These people invariably are requiring oxygen support. 5% of them, roughly speaking, are requiring actual ventilator support. So this is not innocuous. This is that epidemiological curve that's gone viral. You've probably all seen it. And again, the dark purple represents the epidemiological curve during a pandemic where there is no interventions, the non-pharmaceutical interventions, which I'll mention to you in a moment. Conversely, the flattened hash curve is where we want to be, the flat curve, okay, which is going to both decrease the overall number of individuals who are impacted and the duration of this outbreak, this pandemic. I would suggest to you that right now we are where that red arrow is. We are on that first portion of the acceleration phase of this curve. We need to stay on that lower portion, which would then allow us to translate into that flattened curve. That, I would suggest to you, is why we've been as aggressive as we have, why the mayor recommended the proclamation, why we are doing these things very proactively. I won't go into these, but these are what are called the 13 non-pharmaceutical interventions that are used to mitigate pandemics. We have been in recommending and encouraging 1 through 5 for weeks, if not for the last month or two. Essentially, this is the social distancing. This is cough etiquette. This is hand washing. All those things that, again, are very routine during typical cold and flu season. We've also now, however, moved into that second column. These are a little bit more aggressive, and indeed we're at and actually implementing some of these. It's important when we look at it I look at it from a public health standpoint. That's my lens. I acknowledge that it's biased, but again, that's the world I live in. I also, however, acknowledge the fact that this impacts multiple other sectors. And so when we look at the decisions that we make in public health, these are also the impacts that need to be considered when we are looking at mitigating efforts. And then these are some of the implementation considerations. Equity focus. We know that unfortunately there are going to be populations which are disproportionately affected by some of these recommendations and by the illness itself. Messaging and engagement is incredibly essential. You know, I continue to tell people breathe, just not on each other, okay, to really encourage social distancing. I think, again, what we're seeing is the novelty of this and the unknown is very, very concerning. Collectively, how do we encourage people to understand that life is different and life is going to be different, but that doesn't mean life can't go on. When I've talked with my colleagues, when we look at sort of when I incrementally look at how I move through those non-pharmaceutical interventions. People are wondering, well, what's your trigger? When do you say this? When do you say that? I would suggest to you right now, a lot of those triggers have already been hit, not by me necessarily, but by others. But that said, when I've talked with my colleagues in public health, these are some of the factors that they've looked at. We talk about the prevalence of infection. That means the number of number of cases that exist. I look at incidence, and that's again the number of new cases. For me, that's really important because I need to have an understanding of how widespread the disease is in the community, and at the same time, how many new cases are occurring. Do clusters, do outbreaks exist? Obviously, the West Side has seen significant issues in long-term care facilities. That's an incredibly high-risk population for us. And so being able to monitor data, being able to understand whether or not emergency services are getting multiple calls to ACLFs, assisted care living facilities, that's incredibly important for us because that then raises the alarm. And that's why, again, Governor Inslee last week put very strict requirements on long-term care facilities. Again, all this is dedicated to really ensuring that the healthcare capacity is not taxed. Because again, the healthcare organizations, the healthcare system needs to be able to not only address this surge, but also address its regular need. In that vein, for example, a lot of elective procedures are now being essentially discouraged by healthcare organizations, and that makes a lot of sense because they tend to be very labor intensive as well as very requiring of a lot of PPE, personal protective equipment. I mentioned this, these are NPI 6 through 9, both voluntary and involuntary isolation and quarantine. Voluntary, when you look at the healthcare, health orders from a health officer, the RCWs and WACs are very expansive when it comes to mitigating and or preventing outbreaks. And so the authority vested in health officers is pretty broad. When we look, however, at some of these efforts, we always look at the least restrictive. And so we always encourage, it's always voluntary isolation and quarantine. So when we identify individuals who have the infection, we ask them, please place yourself on voluntary isolation. Right now, the criteria are that you are going to be placing yourself on basically on voluntary isolation to the point of either 6 days when you are asymptomatic or 3 days when you are afebrile without a fever. If an individual were to say, you know, doctor, I hear what you're saying, but I've really got to go about my life, then that's when, again, the orders become a little bit more structured, and that's where it's involuntary isolation and quarantine. Not a place that I want to get to, but nonetheless, the authority exists. We're here already, and again, so realize that this has changed since I talked with you last week. Early on, we talked about, again, possibly closing and preventing events from going on, canceling events. Again, the number that I put out with the health officer on Friday was 250. Where did that come from? That's what the governor was recommending at the time. That said, over the weekend, things changed pretty significantly. There was a health officer call yesterday, and all health departments across the state were represented. And we all agreed, given the data that I shared with you previously, given what we've seen internationally, given what we're concerned about, we felt that that 50 or that 250 number was really inadequate. It was much too many people. Also, when you look at smaller jurisdictions, 250 people in a small rural county is half that county's residents. And so that made very little, if any, sense whatsoever. So we collectively said we need to really clamp down, and the number that was decided upon was 50. The other thing that became really evident to us based upon the data is that for many people, they're still looking upon this as daily routine. My life is going on, I'm not changing my behaviors. And so we're seeing this especially in restaurants and bars where it's activity is normal. And we know that that close compact of individuals is a perfect vector for ensuring that this virus is transmitted. So again, collectively, what the governor heard from us is we need to really clamp down. We need to be much more aggressive with our efforts. And that said, that's what led to Governor Inslee's proclamation today which again has significantly limited those types of events. I mentioned this, and again, this is like we get questions about this all the time. Do you envision traffic, travel restrictions? Do you envision actually cordoning off areas? I hope not. I hope not. But that nonetheless may be one of these NPIs which, if things get really bad, we would have to look at. Again, I go back to that epidemiological curve. My hope, our collective hope, is that by being aggressive early, we never have to go here. So as you know, this is what Governor Inslee released this morning. It's essentially 2 weeks at this point, so through the end of March. And specifically, he focused on food and beverage services, which had on-site consumption. So again, that speaks to the fact that you're not going to restaurants, you're not going to bars, sitting there. Rather, if they can provide takeout, things of that sort, that's what's still available, and that's what we're encouraging restaurants to consider. Also affected entertainment and leisure places. That's theaters, that's gyms, that's fitness centers, things of that sort. And then again, gatherings of more than 50 people. If you are less than 50 people, however, then again, we're still encouraging all those social distancing recommendations that we talked about. Plenty of spacing, 2 arms length, cough hygiene, things of that sort, hand washing. So that's where we are right now. We breathe, again, not on each other, and I'll be back next week, and the message may be somewhat different, but the fundamental message is the same for me. We need to be doing things differently. We need to be doing things differently to ensure the health of our community. We need to be doing things differently, collectively, to be working together to really prevent this from getting to the place where we don't want to go.
I had a quick question from a constituent who works at a business who has many employees that could work at home, but the business is saying, no, we're having you work here until the health department recommends something differently. So can you make the recommendation about that?
The health department is recommending something differently.
Okay.
Yeah, we've actually been recommending that for a while. So certainly, especially in light of the fact that we are really actually, asking people and businesses to really support these types of interventions. Workplaces right now should look at opportunities so that individuals who can work from home can do just that, can work from home. I think, again, that's an essential piece. In public health, we talk about making the healthy choice the easy choice. Mm-hmm. Businesses need to make the healthy choice the easy choice for people.
Okay. Any other questions? Yeah.
Yeah, can you speak to how the prohibitions on groups larger than 50 or restaurants, bars, that sort of stuff are being enforced?
So the question again around enforcement, from a health officer standpoint, and to the best of my knowledge, sir, based upon the governor's proclamation, any violations of those would be considered misdemeanors.
Okay.
And again, that's going to require some degree of enforcement. I think the thing that I'm encouraged by is that, and I think it's sort of a collective effort, that people are not pushing back too significantly, but acknowledging that it is a misdemeanor and there is enforcement that will occur.
Okay. One more.
Yes, sir.
Just, I'm curious, is there going to come a point, do you think, where we are going to, I guess, not allow our transit system to operate, buses, close quarters? How is that going to continue forward, do you think?
I think the transit system, and I know we have been in conversation with STA, actually quite a few conversations over the weekend. The STA represents a means, a resource for a lot of people, and we need to be able to get people around. That said, people should be hunkering down. If they don't need to go out, if they have non-essential activities that they're going about their business, they shouldn't necessarily be giving that consideration. We have been talking to STA about doing a lot of those sanitary, a lot of sanitation types of things, hygiene. A little, just an easy thing to remember, if it's frequently touched, it's frequently cleaned. And so there are protocols for how you go ahead and sanitize those areas, and we've been in conversation with STA to, again, modify the work that they're doing going forward.
Great, thank you.
Councilmember Mumm.
Well, and STA is here to give a full report, so stay tuned.
Excellent, thank you.
All right, with that, Dr. Lutz, I know you have other meetings to go to. Thanks so much for sharing your time with us, and we'll see you next week, hopefully. Take care. And I'd like to turn it over to Mayor Woodward now.
I'd like to thank Dr. Lutz, too. It's been a wonderful help to all of us. So thank you so much for that. And thank you for giving me the opportunity to update you on what the city's been doing regarding the COVID-19. My office set up an incident management team about 2 weeks ago. We've been meeting daily, every morning, and through this last weekend to come up with the city's response, both internally and in the community. Internally, our focus, of course, has been on our employees and communicating with them regularly about sanitation, about all those non-pharmaceutical interventions that the doctor talked about. We've also asked our divisions and our departments to identify employees who can work from home. We have canceled non-essential travel, and we've even looked at being creative on work schedules, rotating shifts and things like that, so that we can give people as much flexibility as possible. We're also doing a lot of, as I'm sure some of you are, teleconferencing and televideoing a lot of our meetings, because some of our meetings on this subject get quite large. So we're moving to those kinds of things. Our team is also addressing the needs of the vulnerable, the homeless, low income as well. Today, the city announced, we'll give you more information on that, the plan to not shut off water and charge late fees on utility payments. So now that school has been canceled for the next 6 weeks, we're also looking at ways that we can provide childcare for our own employees within City Hall so that we can staff our shifts and continue to deliver the critical services to our city. But also we have been having conversations with the Spokane School District and also our community centers so that we can assess those centers and see if we can provide childcare for our first responders in the community and also our healthcare providers, and they're on the front lines of the coronavirus crisis. And you'll hear another report, a little more information on that as well. I've also been in contact with our state and congressional lawmakers on some immediate needs that we have, equipment for our first responders through all of this, and also funding to help with more homeless shelters. Our distancing requirements are leaving us with fewer spaces in beds, and also facilities where we could stand up isolation and quarantine locations. So those are all on the radar and things that we're considering. Today, as you mentioned, I did sign an emergency declaration that gives us more freedoms to make decisions quickly and work around labor issues to provide a workforce that can carry out the services for the city. And then today we met with the county and our city partners, municipal partners, to collaborate regionally on our COVID response through the Spokane County Department of Emergency Management. We will meet regularly with them on our regional response, because we all know that as cities we have unique needs, but as a region we work better when we're together. And then we have some individual reports too that we'd like to give. We're going to start with Chief Schaefer.
Well, thank you very much, and thank you for allowing us to speak with you this evening. Just a brief update. My position as fire chief has been moved temporarily, like many of our employees have had to take on dual roles. I'm serving as an incident commander for the city's response to COVID, and that incident management team framework is the way that the mayor, the city administrators, able to delegate their authority, give us very detailed parameters. I just wanted to share a couple of those parameters that we are working on. One is developing this framework for ensuring that we have a continuity of business on a 24-hour basis and being accountable for that. Providing timely and complete and accurate information to the community and to our employees, yourself included. Mitigate the risk of disease spread. Coordinate with our regional partners. Create a safe and sustainable solution to childcare for our employees within this space and within our workspaces. And then also provide sheltering for our unhoused that's compliant with the social distancing requirements. All of those are what we call incident objectives. The way that we manage those and the way that we achieve those is by developing this intra-agency or intra-city team. Many of the people that you see behind you are part of this team. They have dual roles. One may be a finance director today. The other one might be on the team in the finance section or as a finance section chief. So they're really putting in 24 hours a day, 7 days a week. And we have been leading this effort for, like the mayor said, 2 weeks. We've been in front since the disease made its way onto the coast in Seattle. We've been engaged with our partners, and we've been bringing the region along with us from the very beginning. So I'll leave it there and entertain any questions, or would you like to wait until the end?
We'll take questions while you're here.
Oh, sure.
Well, I have a question. I'm certainly appreciate child care for your first responders. However, I'm in the assisted living facility business, and my employees who care for our most vulnerable need child care also. So I'm looking at, are we doing any tiered child care response for those people who are also probably economically unable to provide that for themselves? I think that will be a challenge, looking at all our nursing facilities, all our daycares, what we're going to do for the school kids. Just tell me, how far has that bubbled up?
Right now, the team's focus is strictly on the edict that came out from the mayor's direction for our employees. The public safety employees are covered with the school district relationship that we've been developing and has been rolled out with the governor's statement a few days ago. That's still evolving. I think what we're going to see over a period of time is the direction from the state and the direction from probably the region is going to change. We're, like I said, we're leading this effort in the response. I think as time goes on, those objectives from the team are likely going to change. The people that are serving on this team are probably going to have to change as well, and we'll go through a number of different leadership changes and a number of different challenges. But the ones that you bring up, believe me, are part of the conversation, but we're simply not able to take care of that part until we make this first step. But I appreciate the question. I think we're all thinking the same thing.
Any other questions for Chief Schaefer? Thank you so much for being here and all your work.
And now Chief Meidel.
Good evening, Council President, members of the Council, Mayor, thank you. I was just asked to give a broad overview of first responders and what we're doing. Obviously, we've all seen the precautions, social distancing, washing hands, coughing into your elbow or tissue. Additionally, what we are doing as first responders is our call takers are adding an extra layer of screening calls, screening questions for everyone who calls in to determine if they have symptoms that might be related to the flu. We are, for SPD, we are wearing PPEs as appropriate. I know the fire department also wears their PPEs as well. They're in a unique position because they have to wash theirs after every single call, obviously, so they don't cross-contaminate another scene that they may go to. For SPD, we're telling all of our officers, wipe the interior of your car before every shift with Clorox wipes, clean the back of the vehicle after every arrest. We are encouraging our officers to take as many reports as they can over the phone, even if the person does not display or is not claiming any symptoms. We are requesting complainants step outside as appropriate into the fresh air. We also do have a very thorough contingency plan to make sure that we keep our staffing numbers up. Right now, we've consistently stayed above minimum staffing as well. We've asked our volunteers to stay at home right now. Most of them are a little advanced in age, except for our reserve officers. They're still welcome to come out and supplement patrol. And then we're not taking any ride-alongs until further notice. And then for records, we're following a trend that we're starting to see across the state for records. We had 2 of our 4 public-facing records clerks call out sick last week. So right now we're not doing any CPLs or renewals for at least a couple of weeks. We're going to monitor that to see how that unfolds. And that is a growing trend across the state as well. And then as far as the arrest process, I've been working with the jail. So what the jail is doing is everyone who comes in, it's 1 car at a time in the Sally Port. They will take some measurements from the person that comes in, determine if they're displaying any kind of symptoms or not. And then if they are, then we'll take them to the hospital. If they're not, then they'll take them 1 at a time into the jail. Any questions?
And is it, did I understand the memo right, that you're doing your best to reduce the flow of the jail unless there's someone who's violent and absolutely has to be there?
Yes, and the jails, we expect they're going to come out with another tier of requests from law enforcement as well. But right now, we're looking at trying to limit the number of individuals that are going in and out of not only jail, but juvenile detention as well. So if the person is not an ongoing threat to the community, what we're directing our officers to do is to do a summons. If they are going to be an ongoing threat, then obviously we're going to have to take them into custody.
Councilmember Mum.
Have you seen any impact in the number of calls going up or down or the types of incidents at all?
So the fire department is seeing, in AMR, seeing an increase in those displaying pandemic flu-like symptoms. For us, spoke to our dispatchers this morning, we've had a couple, nothing overwhelming at all. And in fact, the ones that we have had, they've been mandatory responses, domestic violence, those types of things. But for PD, it's not that many at all. For fire, they're averaging so far about 6 a day.
How about crime?
For crime, we're not yet, but interestingly, I had a conversation with someone at one of the fast food restaurants I was at today, supporting our local businesses. And, like they pointed out, in the summertime, we tend to see an increase in call volume. You have all those students who aren't in school. And now with all those students not in school and everything being shut, we hope not, but we do anticipate we will probably see some more calls since they're not going to be in school and there's nowhere for them to go.
Just a observation comment from some people from the Human Rights Commission. They're worried about racial profiling and xenophobia. So I just want to put on everybody's radar the awareness of where this has come from, and that if your officers or anyone is hearing that out there, that is incorrect information around that issues. I have heard some anecdotal stories, so it's out there and there is a concern in the community of color.
Okay.
Thank you. Tim Ziegler?
Good evening. So the Community Housing and Human Services Department has been assigned to a few different task forces. We're following or trying to align with national mass care strategies. Our first task force is led by Tisha Danzig, so she's taken on another role as Chief Schaefer was talking about. On March 4th, the City of Spokane's Community Housing and Human Services Department organized a training of homeless service agencies at the Spokane Regional Health District. They did this to learn about COVID-19 and discuss preparedness efforts. As a result of the training, questions raised there, and the recognized need for a coordinated preparedness and response effort, CHHS convened the first meeting on March 9th of 2020. 16 homeless service agencies, including shelters, day centers, and congregate living facilities, make up this team. Members were provided with assessment tools to evaluate sanitization and hygiene infrastructure, as well as their facilities' access and ability to respond to COVID-19. The early analysis of the shelter provider assessments indicate a potential reduction in existing shelter capacity by 50% to accommodate spacing beds 6 feet apart. That could be a reduction of up to 400 shelter beds. Shelters are starting to forecast how long they can be open with enhanced cleaning at their current resource levels. While financial resources are certainly a consideration, access to the requisite supplies for cleaning poses the most significant hardship. Shelters are desperate for masks right now. When masks become available to the Regional Health District, they will notify shelters and prioritize them as much as possible given the circumstances. Shelters with meal sites are looking at ways to reinforce social distancing. For example, providing sack lunches at the door instead of having people come inside for meals. So that is a report out for the first task force. We also, as of today, assigned internal project managers that have been selected to continue planning and operations for both a feeding task force and a distribution task force. Regarding childcare, we've also assigned an integral project manager and team with the Human Resources Department to assist in planning and convening stakeholder meetings that will assess the current and future needs of city staff. We are still in the preliminary phases of creating appropriate task forces, and we'll know more tomorrow after we attend the disaster emergency management meetings. A few other quick updates. that we heard from Spokane Public Schools, Thursday, March 19th. Public schools will begin offering grab-and-go lunches and breakfasts for any child from 0 to 18. We're also working closely with our community centers to identify needs and capabilities moving forward, and should have a report available early next week. Open for questions.
So do you have staff or other staff at the city scouting other locations to add those 400 beds back, and also isolation places?
Yes, staff and outside partners.
Okay. Questions? All right. Thanks so much, Tim, for you and your team. See Tisha in the back. Keep up the good work.
They're working hard, I'll tell you that. They already were, and now they're really working overtime. Tanya Wallace.
Thank you, Mayor and City Council. I'm here to give you a brief update on the financial aspects of this event, and I really view it as it's two-pronged. The first and most immediate is tracking the city's costs related to responding to this event. What we've done so far and we implemented last week was we've established a core financial team that is going to be point on this. We've also established all the accounting codes so that we can track accurately what is necessary. We've put into place a logistics team so that we can immediately and nimbly respond to the procurement of supplies and equipment as we need. This week's task on this immediate prong is really to help design what kind of reporting is going to be needed for the administration and for all of you on a very regular basis. The second prong to this is not just the cost, but it's going to be monitoring the economic impact, and in particularly the city's loss of revenues. So we do have a team that is going to be looking at that, monitoring that. We did an initial review last week. We do believe at this time that it's going to be significantly more than what we reviewed a week ago. So immediately we were directed by the mayor's office to implement certain strategies to mitigate those impacts here at the city, such as hiring freeze, reviewing large purchases, things of that nature. We're also, beginning this next week, going to put teams together to review the impact to each individual department. There will be different magnitudes of impact to the departments. We will also be reviewing reserves. We understand that there are reserves established for certain purposes, and we may be bringing you requests to utilize those reserves. So that will be considered this week. Do you have any questions at this time?
No. And I just wanted to welcome you officially to the city of Spokane, this side of the river. We're so happy to have your expertise.
Oh, thank you, Council President.
Thank you, Tanya. AC Lopez.
Good evening, Council President Beggs, Mayor, and members of the City Council. My role in this event is to serve as the liaison between the city and the various partners that we're working with, both in the healthcare system, the regional health district, as well as our partner agencies in the EMS world, AMR, and surrounding fire districts, and also interacting on a regular basis with our county medical program directors. So there's a lot of things going on, a lot of meetings that are going on that I feel it's very important for us as a city to be aware of, to be engaged with and support to the extent that we can. There are a number of initiatives that are going forward. Specifically, we developed and adopted a protocol for all EMS providers in Spokane County so that everybody's playing on the same sheet of music. And part of that is just modifying how we respond and then making sure that all the agencies are aware of that. At the hospital level, the hospital systems, regional health district, are working very hard on developing a program where we might be able to establish a alternative site to do assessments and evaluation of people who are worried about being sick. That's a very fluid process. We had hoped that it would begin on Thursday. We're taking a step back after today's meeting. We're meeting on a daily basis to make sure that we're doing it the right way. Part of the challenge with that is the access to test media for testing for COVID-19. It's very scant at this point in comparison to what we're up against. So the group is really taking a look at how we're going to do this with the goal of minimizing the strain on our emergency departments and hospitals. So the peak curve that Dr. Lutz showed you, we want to try to avoid that. And if we can avoid that, I think we can make some headway in terms of managing this disease within our community. Again, there's a lot of things going on, so I actually have a fun part of this job because I get to interact with a lot of different people. So be happy to answer any questions.
So what's the new date for the drive-through testing, do you think?
We're still pushing for, sometime within the week. And again, because it's so fluid and because things change and we're adding additional partners in that are really recognizing valid points that we need to consider in order to have a successful, and the thing we have to be is successful the first time around. And so it's going to be a very structured and methodical approach to it. Yes.
I'm excited about the drive-through, but the pictures I have seen from other cities is where the drive-through line is like 2 miles or longer, and people could be in their cars for hours and hours. And how are we thinking about mitigating that in some fashion? Or I'm sure you are, but give me an idea.
You must have been listening in on our conversation this afternoon at our meeting. So that's one of the things that we want to make sure that we try to manage as best as possible. So all of our healthcare system partners have established virtual appointments. So they're encouraging people to utilize that, which will help us kind of screen and triage folks. So if you have a virtual appointment with a provider and you're sitting in front of them virtually and they can evaluate you there, they may be able to make the recommendation that, yes, you're not feeling well, you're not sick enough to be in the hospital yet, so we want you to stay at home. We want you to self-isolate, voluntarily self-isolate, stay hydrated, stay on antipyretics, those kinds of things. It may get to a point then through that virtual screening where that provider might say, we need you to go to XYZ location. So we're trying to manage it that way. What we don't want to have is that massive influx of people. That leads to frustration, et cetera. So that was one of the things that was brought up during our meetings the last couple of days is how do we effectively manage that and make sure that we're doing it the right way? Hope that answered your question.
Yeah, thank you.
So just as a quick, so what you're saying is they would need a referral to go through the drive-through testing, essentially?
An informal referral, yes. Yes.
I've seen some research that for folks who are showing symptoms that some of like lung scans can actually reveal that they perhaps have the virus. Has there been any consideration of doing something like that?
You know, I have not heard that, and that hasn't been a topic of discussion. So I don't know, I guess. That's the best answer.
Can you share any information from our healthcare partners of what they're doing to kind of increase their capacity by reducing people currently scheduled to come for surgical procedures and other kinds of things? So what are they doing to prepare for the onslaught, so to speak?
Sure. So I am aware that this afternoon there was some discussion at the state level about minimizing or deferring elective surgeries and that kind of thing in lieu of the current outbreak. That would obviously reduce the stress on current resources to a certain extent. In terms of other strategies, no, I'm not aware right now of anything else like that. Our biggest challenges as a healthcare system, and particularly for EMS, is access to personal protective equipment and the lack of availability of testing medium to be able to do tests when tests are warranted.
All right, thanks Assistant
you.
Chief so much.
Scott Simmons?
Good evening, council members, mayor, and members of the public watching at home. What I wanted to do with the Public Works update this evening is just really reconfirm the city's commitment to maintaining our critical public services that Public Works provides. These are essential services that we all come to be used to every single day, such as picking up garbage at your curbside, making sure we're providing clean drinking water, and making sure our transportation network maintains its operational efficiency. Similar to our colleagues in public safety, many of our employees don't have the option not to come to work. These are services that our community comes to rely upon, so their attendance is really important. So we've been working on a number of things that help us continue to maintain those public services. We have been working on finalizing the development of our critical staffing plans that looks at really the essential operations of each of our department's functions and what sort of level of employees are needed for each of the maintenance of each of those things. That helps us then prioritize which services have to keep continuing versus which ones we can possibly discontinue for a period of time in the event that we happen to have absenteeism for our employees. We're also, with the announcement of the school closures, it impacts many of our employees who have children at home, child-age children. So we are working on identifying flexible shifts that our employees can utilize that helps one of their spouses or partners stay at home, or alternatives if they're the only care provider at home. So the other piece then to ensure our employees can continue to come in is to help make sure we're maintaining a safe and healthy environment in our work conditions. A lot of our groups and crews come in with 60 to 80 other members, other employees when they come into work. So we're looking to try to change start times, change end times, move their shifting so that it minimizes the number of people in crew rooms or break rooms at any given time. Our street department actually has a split shift scheduling during the winter time that allows us to keep operations covered 20 hours a day, 7 days a week. A good example, they're staying on those split shift schedules for a period of time. That allows them to take what's typically 60 people in their crew room in the morning down to about 15 people. The other thing that we're doing, of course, is encouraging our employees who can to telecommute from home, so we're allowing some of that flexibility. 2 or 3 other quick things. Our construction jobs, we're intending to continue to put those out for bid. We recognize the importance of jobs and dollars being injected into the community. So our spring, summer, fall construction is still planning on going out. That's really important, I think, for our community, given the other economic impacts that are expected to occur. So the changes to services that the community should be aware of today, and the mayor had announced earlier today, is we are suspending the shut-off of water services during this event, and we are discontinuing the application of late fees due to delinquent payments or due to delinquent balances during this event. Those are the only 2 real services that have been impacted. As I mentioned earlier, if we have high levels of absenteeism, we may have to scale those down, but we will communicate with this council and with the community as that occurs. And then a really good reminder for folks with the run on some of our products in stores, such as toilet paper. It's important for our community to remember the only things that you should be flushing down your toilet is toilet paper. So in the event that you find yourself with wipes or paper towels, do not dispose of those in your toilet. Likely, you'll see the impact in your own sewer system before we see the impact in the municipal system. So it's just a really good encouragement to folks to not do that. With that, I'd be happy to take any questions.
All right, thanks to you and all your team members.
We have a couple more. So Eric is next. Eric Finch.
Good evening, all. For the technology side, we've done some significant upgrades over this past weekend to both stabilize our network and by an order of magnitude increase our capabilities. That includes this week upgrading our bandwidth for City Hall and some of our other administrative centers from 1 gig to 10 gigs, which should allow, with other measures we're doing, for just about unlimited work from home capabilities for our city staff. So those that have that capability, we are be able to facilitate that, as well as virtual meetings. And this starts by leveraging assets we have, laptops we have, and technologies we have, but we're also basically adding to that mix of tools just about daily. We're also working to enhance, basically the telephone services in terms of soft phones, or even 311, being able to take calls from alternate locations like their home, so we can facilitate those important connections. We're also moving to a 24/7 support model, so ultimately, as we see the divisions moving to alternate staffing schedules, we will be able to support technology operations on a 24/7 basis until further notice. And then we're also assisting with the Emergency Coordination Center and the city regional response efforts. Any questions?
Way to get that project done over the weekend. That was great.
And Wes Crago.
Good evening, council members, council president, boss. For the most part, I'm just very proud to be able to represent the staff and to talk about the staff a little bit. The mayor and I both kind of overlap our duties quite a bit with seeing a little bit of everything going on. Largely the mayor's focused on outside, external relationships, and I'm a little more focused on the inside of what's going on. And with that, I'd kind of want to just a couple global comments. It's a little bit like being on the airplane when they tell you to put your own mask on first. We have to support and protect our own staff so we can support and protect our community. And a lot of things have been covered already, some of the things with childcare and schedules. A few of them that haven't been covered is we've got a daily information and outreach to both our staff internally and then to you with a daily update, daily messaging, not just about the non-pharmaceutical interventions, but kind of the status of what's happening within the city. And we have a survey that's going out so we can know what our needs are as far as childcare providing and what staff might be impacted. It could be as high as 50% of our staff could be impacted by the school closures. We're limiting a lot of our meetings and travel, things have already been mentioned, but any meeting that has to take place, people are telecommuting into it even if they're within the building. Cabinet meeting this morning, one person telecommuted from about 10 feet away. It just makes sense to limit how many people can be there at any one time. We're limiting cash transactions. We're still allowing that, but we're kind of limiting it to one window where we can go through less protective gear than otherwise we might do it that way. There's a lot of case-by-case incidents we have to deal with from an HR perspective. There's a rather lengthy document we gave out to all staff, kind of guidelines of when to use leave, when you may be asked to leave if you're exhibiting signs of illness. And a lot of those come down to case by case, travel, where you've been, specifically where you've traveled from. We've also expanded the use of cleaning in public areas like here and in other spots around City Hall. We've had to prioritize a lot of our work. That this is taking a lot of the extra oxygen in the room, responding to this. You heard all these staff members represent different divisions of the incident management team, and that's in addition to their normal daily work. So we've had to prioritize some of the work that's not emergent or can be delayed is being delayed. We do have that lengthy HR policy and guidance we've kind of shared with our regional partners around the area. If you want a copy of that, we'll certainly ship that to you as well. I'm extraordinarily proud to be a part of this staff. The work that they're doing literally around the clock over the weekends is frankly inspiring. And with that, if you have any questions.
Councilmember Wilkerson.
Just clarification, I know you've mentioned we've increased the cleaning, the sanitation of the building. Have we increased city staff, or have we contracted someone to come in to assist them with that?
To date, that's all been with our existing staff, just doing it more and doing it in the public areas more commonly. And then kind of informally, at every level, we've tried to provide extra wipes, just like this, sitting on just about every meeting desk in the city right now. Yeah, just basic hygiene that Dr. Lutz has recommended.
I was just concerned, I mean, I know they're not a big department, so if they have their own health issues, then that really puts a strain, and do we have Plan B if Plan A
David
doesn't work
Steele
out?
is on top of that. We've even
Okay.
worked up the budget numbers for what expanded cleaning and daily cleaning of the large public facilities look like.
Okay, thank you.
Okay, Mayor?
Thank you. So that is our individual reports. I just wanted to close by saying, you know, we really need to do our part with these latest mandates from the governor to support our businesses, our small businesses. They are going to take it, already have, to last week or so, but definitely now taking a huge hit. And so we are working with Downtown Spokane Partnership and Greater Spokane Incorporated to find ways to be able to support them in a bigger way. And just our office, the mayor's office, just came up with a fun thing to do. It sounds pretty small, but small things add up into big impact. But that was going out and doing takeout to our favorite eateries every day and using the hashtag #OrderUpSpokane so that we can just motivate people to get out and have a little bit of fun and be creative about ways to support our businesses. They are the lifeblood of our economy, and we want to be able to keep their doors open so we can keep people in their jobs, as many as we can. We have a great community. I couldn't be more proud to be the City of Spokane mayor. I've been here 30 years, and we've been through a lot. I've seen a lot. Ice storm, firestorm, windstorm, Freeman School shooting. We do well. I mean, we come together, we work hard, we look out for each other, we're resilient, we're strong, and we'll get through this. And I think as a city and as electeds, we need to reassure our community that it's going to be tough, it's going to be challenging, but we're tenacious, and Spokane is tough, and we're going to get through this, and we're going to be even better when we get on the other side. So.
All right. Thanks so much for joining us, you and your team.
Yes, thank you.
Yeah, really appreciate it. I've asked Council President Pro Tem to reach out to a couple community partners and bring them down to give us some updates on areas outside of what our team's doing. So, Councilmember Mum.
Sure, I think we'll kick off first with our statewide commerce director, Dr. Lisa Brown, whom we are fortunate enough to live in our community, and she is working on outreach to support commerce statewide, and we would love to hear from her.
Thank you, council members, and to the administration. Thank you for working together and responding proactively as you can to this very unprecedented healthcare and economic emergency. Lisa Brown, Department of Commerce. I think I might take the mic here.
Yeah.
How's that? Does that work? Okay, great. Wanted to let you know that I won't be able to report on the whole spectrum of things the state is doing. Operating out of the State Emergency Operations Center, and there are multi-agency teams taking on a variety of things. Obviously, public health and making sure we have a healthcare system that can respond to the surge in demand is number one. There are also teams looking at basic necessities for families like food security, housing security, childcare. Councilmember Wilkerson mentioned earlier, and other issues like that. We also have an economic recovery and retention team, and that's headed up by me and the Commissioner of the Employment Security Department, Susie Levine. And we're looking at both business assistance and assistance for workers. And it's a multi-agency team. Many of the agencies like Department of Labor and Industry and Employment Security and Department of Revenue are issuing emergency regulations to delay penalties or penalties associated with taxes to create more flexibility in the programs that they administer. And then as soon as this is up, I'll tell you a few things in particular that Commerce is working on. We have business and workers together in this team because, of course, their fates are interrelated. Businesses that have been calling us, number one thing they say is, I care about my employees. Help me figure out what I can do in this situation. And of course, employees care about their employer, and they know that their fate is intertwined with their employer. So I just want to tell you that public health is number one for us. And as your health director said, the number one goal of the policies that are being put in place is to slow the spread and flatten the curve. And if we can do that, then our healthcare system will be able to respond to the emergency, and then we can move forward more quickly on economic recovery. So many of the policies will have a very disruptive impact on the economy, and clearly already are. But the goal is to get through this quickly as we can, to get on the other side of the curve so that we can really start then re-engaging more normal economic activity and working towards economic stimulus and recovery. Let me give you a sense. I would just echo in terms of searching out reliable sources of information right now. The Washington State Department of Health site is excellent. There's a call line. There are resources there. There are references to other resources. So number one, that's what I would encourage everyone to look at. If you're specifically interested in economic issues, feel free to go to our Commerce site. It's commerce.wa.gov. And we link to the Department of Health, but we also linked to state and federal resources for businesses and workers. Oh, let's see. I'm left-handed, so I always do these things backwards. Let's get to next. I might need some help with this. Oh, I can use the arrows here? Yeah. Thank you. Yep. Okay, there we go. This is a piece of our website, and again, when you go there, there will be a whole variety of resources for businesses and workers. I'm going to start talking a little bit about employees, and then we'll go to businesses second. But just to give you an example, both federal and state resources will be available. To start with employees, we do have workers in our city and across the state who can take advantage of, first of all, leave, sick leave, or other types of leave that is already associated with their workplace. We encourage people, of course, to take advantage of those types of policies, first of all. Knowing that that then may trigger higher rates for their employers, the legislature has set aside in its emergency response fund of $200 million, $25 million to, for example, buy down what otherwise would be rate increases for unemployment insurance for employers. So again, if you have leave policies, take advantage of leave policies. If you're qualified for unemployment insurance, obviously take advantage of unemployment insurance. We know that there are many workers who are either part-time workers, temporary workers, maybe independent contractors, or they're in the gig economy. Certainly I know that, my own son and others that work in music or art or entertainment, or they're Uber Lyft drivers, things like that. They may or may not qualify for the systems that we currently have in place. So one of the things we are working on is a gap analysis to see who qualifies and who doesn't and what we can do about that. For businesses, there's some federal relief that's been put in place. It's mostly in the form of Small Business Administration loans at this point in time. And we've heard from businesses that they are not always in a position where a loan is going to make the difference for them. So other types of assistance is being discussed, and I will, in a minute, tell you what I think one of our key priorities are at the federal level. Because Commerce also has housing and homelessness in our portfolio, I wanted to specifically share with you tonight something that we were able to contact the state about today, and that is, as the mayor mentioned earlier, the need for immediately every county to be thinking about where are we going to have people stay if they're in a shelter and they're too close together, so we need more distancing for the homeless who live in shelters. What about people who are sick and need to isolate or be quarantined? However, they're not sick enough to take up one of our scarce hospital beds. So we want to move them into another environment that's appropriate for them. But perhaps they're also in a position where they can't isolate or quarantine themselves at home because maybe they have family members that are vulnerable, and that is not a tenable situation. So we need every county in the state thinking, and local jurisdiction, thinking about how to build that capacity. So today, Commerce announced a $30 million statewide program, and it's quite flexible. We know it's not enough, but we want everyone thinking about what are we going to do in order to build this additional capacity so that our healthcare system can function more effectively, but people who need a place to be isolated or quarantined and can't do it in their own home have that place. The grant is going out based on a minimum amount for every county in the state, and then an additional amount that is tied to the point-in-time homeless count that we just completed. And I worked on with Tisha from the city and others. So your proportional share will also, the grant will be tied to that. We estimate right now for the county of Spokane, that will be approximately $1.4 million available essentially immediately. The grant requires that the county and city collaborate, and I know you're already doing that, and that that whatever plan you put in place, also that the local public health department agrees with the public health benefits of the plan, and it meets their requirements. So that is this piece. And then finally, returning to workers. As I said before, the Employment Security Department has produced a scenario here that will be useful for businesses and workers. If someone is ill, what can they take advantage of? Fortunately, the state has passed a paid family leave bill. So in some cases, there is leave available for people who are caring for a sick family member. Unfortunately, that program is just getting underway. It would be great if we had it a year ago, so it would be easier to ramp up. But that is there for some employees as well who need to care for a sick relative. What you can see from this chart is where there is a check, that's an opportunity. Where there is a question mark, we're trying to clarify that and work on it. And where there is an X is a gap. Frankly, it's a gap. And so number one for us is that we, as I think the governor announced earlier today, we are hoping that in the next economic assistance bill passed by Congress, they include what we call disaster unemployment assistance. So if Congress says that a pandemic can count as a national disaster, and if then the president declares that we have a national disaster, that widens the range of who can qualify for unemployment insurance. And as I said before, those temporary part-time workers, gig economy workers, we very much need a solution for them as well. So I'm going to stop there. Again, this is a probably unprecedented economic disruption certainly in my time in public service, but possibly in all of our times. So it's going to seem very dire, especially over these first few weeks, with so much economic activity that is normal not occurring. Our goal is to analyze the gaps, work with each industry. Obviously, hospitality, restaurants, and hotels are being very hard hit right now. But frankly, every corner of our state and every corner of our economy will ultimately be affected. So we've got to work on providing immediate assistance to families and businesses, and then start to work on resiliency and recovery and economic stimulus strategies. So thank you for inviting me to share a few of those ideas with you, and I'd be happy to answer questions.
Thank you. Any questions? Councilmember Cathcart.
Yeah, has there been any conversations about working with banks to create mortgage deferral programs so that landlords can be more flexible with tenants?
Those conversations are taking place. I believe our Department of Financial Institutions is currently involved in having some of those conversations. And we've had businesses already step up and say things that, monthly charges that they will not penalize people for not being able to pay in the short term. There are some jurisdictions in the state that have passed moratorium on evictions. Of course, many of these things have cascading effects because then landlords are faced with mortgage or potential foreclosure. So we're having conversations about what that would look like were some of those things to go statewide, and we are very well aware of the cascading effects of one rule that provides some relief and then provides difficulty for a whole other group of individuals.
Councilmember Rowe.
Thank you so much for coming tonight on such short notice. Right before we started the meeting, you were mentioning to me that other cities are innovating, and we certainly want to reach out to them as well. If there's some things that you have become aware of that you're seeing that are working, I'd love to hear some of those or find out later too.
We'd be happy to do that. As you know, the center of the biggest impact thus far has been King, Snohomish, and Pierce County. And therefore, we've been working closely with those cities and counties. Had a conversation with the mayor of Seattle this afternoon, and we want to share what they're learning and the practices that they've developed. So we will certainly make that available to you. For example, we understand that they might be able to use some block grant funds in a more creative way. And I know the city's going to be, we heard the brief revenue forecast. You're going to need a whole toolbox of things that you may choose to implement. So we'll try to be a good conduit of that information to cities and counties.
Thank you again so much for coming down and all your work for the state and Spokane, your hometown.
Thank you, Council President.
Next, I'd like to invite up STA CEO Susan Meyer, who runs the largest transit agency in Eastern Washington, which not only serves the city of Spokane, but the greater Spokane region.
Thank you, Councilmember Mumm, Council President Beggs, members of the council. Thank you for inviting us to be here tonight. My name is Susan Meyer, and I'm with Spokane Transit Authority as the CEO, and I am joined by our response team commander, Steve Blaska, who is the Chief Operations Officer. And let me briefly tell you that Spokane Transit is fully prepared to continue meeting the essential travel needs that we have during the pandemic. Fixed Route is providing full non-EWU school day service, paratransit for people whose disabilities prevent them from using the bus, operating full service, and van pools continue for those who are still commuting. The system is safe to use. Buses and vans are being sanitized every night. We clean the plaza, our downtown transit center, 5 times during the day, and the bathrooms every half hour. Our drivers are equipped with personal protective equipment, including hand sanitizer for their use, gloves if they wish them, Clorox wipes so that every driver wipes down his or her driver's area, and the fare box, which is where fares go. We have pre-positioned supplies, that is to say not enough to call them stockpiled, but enough for about a month, and we have many orders placed. The riders' response has been swift in the last couple of days as people have learned that their children are not going to be in school, as universities and community colleges, who are large ridership generators, and schools are out, that ridership had gone down on the bus about 11% through Friday, and on Saturday it was down 31%, and on Saturday 26%. So paratransit is down about 10%, and we will know more tomorrow about ridership today. This allows us to maximize social distancing, the same level of service with fewer individuals on the bus, but still providing service to essential travel areas. So we have stayed connected with the Department of Transportation and the Federal Transit Administration. We are in regular contact, as Dr. Lutz said, with the Spokane Regional Health District, with the jurisdictions in the county through the emergency management system, and through the transit network across the country of what's going on through the American Public Transportation Association and our own state transportation association. So we are meeting all of our marks, exceeding the measures of other transit agencies, proud to be doing the work and supporting the community. Thank you to Councilmember Mumm, who is the immediate past chair of the board of Spokane Transit Authority and a current board member.
Councilmember Wilkerson.
I just want to thank you for keeping the buses running. My employees and the people I serve use paratransit, and we would be sorely hampered in doing our work if the buses were not out there. So
We understand that.
thank you so much.
You're welcome. We are pleased to do it.
Councilmember Cathcart.
Yeah, how are you enforcing like social distancing on the buses and in the plaza?
We're encouraging it on the buses, and we are more strongly encouraging it inside the plaza. Counting the number of people who are there, encouraging people who are not immediately to take the bus to take the next bus.
I was just going to say thank you. We have a board meeting that'll also be televised this Thursday
Yes.
for updates, and we will be having further discussions about this evolving circumstance, and just want to thank you and your staff members for making it work and taking care of our
Thank
community.
you very much. You're welcome.
All right, thank you. And finally, last but certainly not least, Spokane Public Schools. Dr. Oscar Harris is here to update us on our largest school district, and go ahead and come on up and tell us the latest. This is impacting every neighborhood in the city.
Thanks for having me. Good evening, council members, council president. First of all, I want to like to say on behalf of Spokane Public Schools, we are excited about the opportunities to continue to partner even more intentionally around, especially during this time. So I can tell you that countless hours has been spent with us as staff there, as well as with individuals from the city at large. So we'll say again, thank you for your support, and we love Spokane. There's a lot of support, especially during this difficult time. So I think, first of all, if I can, I'll start out by saying, with new information surfacing, as you are fully aware of each day, we are constantly working on plans that we initially had, I think plans that we had in place a couple days ago, we totally had to alter because of new information that's coming out. However, I think we have a wonderful team that's able to make those adjustments accordingly because we work with kids. So I think that kind of helps out a little bit. And so one thing in particular is, even though we would like to have a plan that we can tell you that's going to go to April the 24th, where as we get those new changes, we're going to be intentional about, especially through the about relaying information, especially through the Office of Family and Community Engagement that we have there currently. So, but we're going to continue to do our best, definitely come as needed, as well as continue to partner intentionally with getting information out there. We also are sending out regular updates via our website, and we also have used our phone lines, robocalls as we'll call them, to kind of communicate with parents as much as possible around different things that are happening. And we're continuing just to provide those daily updates as we can, and we started this actually on March the 12th. I think getting to some of the logistical challenge and the elements that many and most people are asking about, because we are getting inundated with a lot of phone calls, which is totally understandable during this time, especially as you know, being places to where our kids in Spokane community at large was spending a lot of time with trusted adults, our teachers, administrators, as well as other school staff that's working in the classified area. So beginning tomorrow, we're going to be actually closing, the sites. We had a day today open to where we can actually begin to start really looking at trying to do as soft handoffs back to the community as far as our children was concerned. We actually wanted to have an extra day to actually work with kids and be able to say goodbye. In addition to being able to say that, we was able to partner with Second Harvest and Bite to Go program to be able to send home a couple meals to actually last probably a couple days for some of the students. So we're excited about that partnership to be able to do that, because that is one of those major logistical challenges that we're talking about. And I'll give more information about other things that we're going to be doing to actually try to provide a critical element as far as a resource around food to our families that's in need at this current time. So all sites will, hold office hours this week so that families can still stop by and pick up academic material as well as medications they may have there. And if needed, especially if they weren't able to go today since we was closing today. You can also they'll be able to find specific hours as far as on the school website in terms of when schools will be open to where they can stop by. In addition, in talking about, the meals, we did the grab and go meals, for today for Bite to Go, but starting on March the 19th, we also will be having grab and go meals as far as a breakfast and a lunch together that we're going to be passing out at quite a few meal sites that we have across Spokane Public Schools. Quite a few of our schools will be open from like 11 a.m. to 1 p.m. We have 16 locations that's actually going to be open to be passing out meals, one breakfast as well as one lunch for students. And I have a list of those particular schools that will be open, and I would highly recommend individuals probably go to the website, because if I list them off, you get it, Meals are going to be offered from Monday through Friday. We're going to be supplying the week. And we're telling families you can go to whichever site that you pick. And our goal is to have these sites this week and possibly begin to start looking at expanding the service as early as next week. What we're doing, our nutrition team have actually been working diligently to actually put together an immediate plan, and they actually have a 3-tiered system in which we're looking to ramp up our ability to serve food to families in the community quite rapidly as we need, but this is going to be the initial plan. As far as supporting students around their academic needs, and looking at the resources that they may have available or may not have available to them, we're also looking at being able to offer some laptops to families and to students, and it's going to be pretty much on somewhat of a need basis as well as availability. But at this time, we're looking to offer possibly 1 device per student and up to 2 per family. But our request for those particular type things will be on the website, and if you look under the tab headlines. And so when we're looking at Learn at Home, we know that there's going to be a lot of unstructured time, and we know that some families may need additional support as it relates to navigating what education can look like, or them supplying it to their students. So we have packets and stuff that has been developed that's actually gone home, as well as teachers be able to, and parents be able to reach out to teachers via email and all of those types of things. And those packets would include scheduling ideas, sample daily plans, as well as learning guides for them when they're at home. And another thing that we're going to be looking at is trying to encourage, as much as possible, families to be able to use, structures and routines to kind of help combat some of the challenges that may be associated with anxiety, because we are aware that many of our kids depended upon us as a district to have those routines. So that's something. So childcare is probably, moving on to that resource, that is the topic. That is the topic, and I think in addition to it being the topic, knowing that we have families that are working, knowing that we have first responders who are out there who are laboring to kind of help us during this time, we are trying to be extra thoughtful and trying to be extra conscientious about having the potential of a limited resource. That's another reason why we're trying to, and no, we're not trying, we're actually following through on beefing up our communication to community service providers, as well as our nonprofit sector, as well as our faith-based community, reaching out and saying that, hey, if there ever was a time that we need to connect and really begin to start talking about how we're going to support our community, this is a time like right now. And so we're having some awesome results so far. We're doing things, of course, through Zoom meetings, as well as having phone calls. And one thing that I know we are excited about with the Office of Family and Community Engagement with Spokane Public Schools is that we have families who are saying, we want to help, we want to volunteer, we want to be there, and we want to support the efforts that's happening at the school and in our community at large. So that's very exciting. I never doubted that it would happen, but it's very exciting to do that. But I'll say again, something that we are doing as we're closing our express sites, even on tomorrow, we're looking to kind of devise plans to kind of look really at the need in light of us getting, us looking at the request to begin to start looking at first responders. We're really looking at that, and we're hoping to have an update as early as this Wednesday regarding our ability to continue to provide some type of child care for some of the existing families that we have in the system. And so that is kind of, I guess, a very quick update in terms of what's going on. So at this time, I can take questions, but I do have to admit, I may not have the answer.
No, I just have questions. So they'll be able to go to any one of the 16 sites, correct? They won't need any identification or anything. They can just actually walk in, get there. How's that going to look?
Right. I definitely want to look into that. I can tell you that there's a sign-in that typically we look at in terms of students coming and going, but since they're going to various sites, that will be probably a little bit more challenging, but we're definitely going to have a sign-in sheet for that particular thing. Yeah, for that reason, so we can kind of possibly track a little bit. So.
But they would be fed?
Yeah. And it's going to be a stop and go as well. I want to reiterate that. That means that they're going to come and they're going to pick it up and they're going to be moving with it. Okay?
Councilmember Mumm.
I noted that the ACT, SAT testing has been halted for now, and some other things probably will be deferred.
Okay.
But do you believe that based on this packet approach, that students will be able to finish on time for school and they will be able to keep up with their schoolwork?
That has been also a topic of discussion. And as a matter of fact, at the secondary level, definitely with high schoolers, you're talking about those juniors as well as those seniors. So we've had actually a special committee that's been tasked just with that in particular and has been working with the state on looking at what the requirements are and how we can begin to possibly even try to service that, because we know it wasn't not their fault that we had to close.
Right. Just a comment.
Okay.
My grandkids are wigged out that they'll be going to summer school. So just want you to know.
You're just getting summer break early.
It's summer break early right now.
Any other questions for Dr. Harris?
No, but I really want to appreciate the partnership that we've built with not only your district, but the other districts, and such a huge part of our community. And thank you so much for being proactive. And please continue to communicate with us, and we can have you back or others as well, because that information needs to get out.
Absolutely. Thank you for having us.
Thank you.
Thank you for staying.
And that is the community report for
Yeah.
tonight.
So that brings us to the end of our speakers, and we're getting close to the end of our meeting. I wanted to give a special thanks to my council members who have been working around the clock, and including our council members who are ill and are still working for you. And we have staff members. I've got Mark here and Hannah Lee here. Really, thank you all for staying and working with us. I just wanted to let people know that, like most of you, a week ago, we had a whole suite of priorities and projects that we're working on. And suddenly today and this week, that kind of all goes out the window. This is job number one for all of us on the council and our staff, and we're prioritizing. And although we didn't create space for public comment tonight, you have our email addresses. So please give us any feedback that you want. Give us your hopes and your dreams. Really, a lot of our work is figuring out what the federal and state resources are. Cities by nature don't have a lot of cash, But the federal government and the state government have really been stepping up, and so I've been directing our staff to align themselves with those programs, figure out the eligibility, and then educate our community members so that we can get access to those funds that have been provided, that will be provided. I just wanted to highlight again Lisa Brown's statements. The state does have substantial unemployment benefits. We do have a family leave program. And I just saw emails today, a lot of the regulations that would have precluded people are by the wayside now. And so those are there. I also wanted to give kudos to the mayor. She really helped lead our whole community in regional collaboration. And so that is all going on things. And the council, we did work on, and we passed a resolution in support of her declaration of emergency. And I just wanted to assure people who come to us for answers, she has powers under that, but we reserved all of our powers as a council to address our issues and our priorities, which I would just like to summarize is investing in our people and our businesses. That's what we are about. This will pass, and we have to preserve people, their families, and their businesses so that when the virus has passed, we can spring back to life and be the amazing Spokane. And along the way, in our city and our council and our government, we will care for the most vulnerable. So that's what we're up to. We're planning to see you next week at our regular council meeting, unless you hear differently from us. Please have a good night and take care of yourself, your families, and your neighbors. We're adjourned.